Hematology, oncology, anatomy. For Heme Onc anatomy, what they really love to test on is hematopoiesis and how that plays into the larger role of producing all of our blood cells. So what we need to understand first and foremost is that we always start with a multipotent stem cell, also known as hematopoietic stem cell. And hematopoietic is in the name. Heme is for blood, okay? And whenever I see poiesis or poetic, that means production of. And so the first word that is going to be provided is going to tell you what we're producing. So once again, starting off, every blood cell starts off as a multipotent stem cell or hematopoietic stem cell, same thing. Now, there could be two ways that this can progress. First way it can progress is to the myeloid lineage. So it can become a myeloid stem cell, which can produce four separate things. The myeloid lineage can produce erythrocytes via erythropoiesis, which is just red blood cells. Secondly, it can produce thrombopoiesis, which is platelets. It can undergo granulocytopoiesis, which can produce granulocytes, which are known as eosinophils, basophils, and most importantly, neutrophils. And lastly, the myeloid lineage can produce macrophages, which come from monocytes, via monocytopoiesis. Okay, so that is the whole entire lineage via the myeloid stem cell. Now, if we were to go back from the multipotent stem cell, it can also produce the lymphoid stem cell. And the lymphoid stem cell produces our lymphocytes. Okay, so lymphopoiesis produces our B cells, which become plasma cells, as well as our T cells, which become T helper cells and T cytotoxic cells. And lastly, the natural killer cells. So those are the two lineages that stem from the hematopoietic stem cells / the multipotent stem cells that we need to be aware of. I'll be going into each of these cells specifically now. First, we have the neutrophils. Now, neutrophils are known to just react to acute inflammation. They go to the site that needs response, immune response, and they are the first responders. Okay? They cause us to produce pus. Dead neutrophils is what pus is. Now, what we'll see a lot of the time in questions, they'll say left shift when it comes to an immune response. A left shift just means that there's an increase in neutrophil precursors. Okay? That's all that it means. We have neutrophils increased in the peripheral blood. So it reflects usually inflammation, infection, or maybe a cancer. So that's all that they're talking about when it talks about left shift. We'll dive more into neutrophils later on. Erythrocytes, all that we really need to know about them is that they carry O2 to the tissues and they carry back carbon dioxide to the lungs. And what they love to ask about is that they are anucleated. So they do not have a nucleus and they lack all organelles. So keep that in mind. Next is thrombocytes, also known as platelets. They're much smaller than the red blood cells. And we can talk about how platelets function later on in the physiology videos.